Hi everyone, my name is Rabia Chowdhury and this presentation is going to be regarding the practicum experience, the portfolio update, and also the research project update that we will be completing in the capstone course. This is for the HAP 789 pre-capstone course at George Mason University as part of the Health Informatics Master's Program. An update on the proposal. Right now, I have just been spending time picking a topic, trying to see which topic that I'm interested in researching and something that I can write the 15-page requirement on as well. A topic where I can talk to experts in the field to get more information about, where there is just enough literature for me to understand the topic more, but also to do my own predictive research on. So a lot of this time was spent looking at different research and literatures to see what was out there. The research topic that I went with is e-learning in the health field, and I felt that this was especially relevant now due to COVID because a lot of programs are now online, not just in the medical field, all fields, but even students who are in medical school, a lot of their classes had to be online, whereas usually that would have been like practicals that they would have learned when they were in school. And a lot of healthcare systems are facing a range of challenges, including demographic changes, medical technology costs, a lot of inequalities between countries, and it's made it difficult for medical training and professional development to adapt to the changes of the healthcare professionals in increasingly patient-centered or remote delivery context. So in response to a lot of these challenges, medical education programs and other health programs have adopted more e-learning approaches, which can vary from context to context. So basically, my research project is going to investigate whether mobile learning has more advantages or disadvantages when applied to healthcare professionals. The topic will assess how mobile learning affects exam scores, patient relationships, and performance in the workplace. And my hypothesis is that e-learning is not as effective in in-person learning, especially when it comes to the medical settings, when it comes to nurses and doctors. There are just certain things that you need to see and practice rather than doing it virtually. So where I am with my research right now is just gathering the resource, gathering the literature, because I am going with the evidence-based research option. So therefore, I'm not going to be in a specific institute. I'll be conducting this research by myself. And the research project will address whether e-learning poses more problems or risks in the medical world and whether e-learning should be increased or decreased. So some of the methods that I will conduct is a literature review, talking to current healthcare and medical students, and conducting interviews and surveys with healthcare professionals. Having a professional response from real doctors and healthcare workers would increase the opportunity for a buy-in if this proposal was shown to other people. I would also compare exam scores and performances across students who had e-learning versus in-person to see how the performance is affected. So since I am going with the evidence-based research option, I don't really have a preceptor, just multiple people that I'll be working with through the surveys or interviews that I will be doing. And then, of course, Dr. Green, who is head of our capstone course. The professional career portfolio experience was definitely a unique one. This was the first time that I had to do this for a class. I've never put together a portfolio for a job before. It would usually just be my resume and cover letter, and this is the first time I had to put together a portfolio that contains so many different things. There definitely were things that we were adding to the portfolio that I would not have considered adding prior to working on it, and that includes like adding my past schoolwork, the projects, the links to the YouTube videos and presentations I have made in the past, all the business memos and program codes. I would have never thought of including those as a part of my portfolio. The leadership philosophy was also completely new to me. I never would have even thought of putting that into something like a resume portfolio before. And even the thank you letter, I've written thank you emails before that are very small, but not a nearly entire one-page thank you letter. That's not something I've done before either. There are definitely new things that I learned with the portfolio that I could add to my professional resume and cover letter. Now, would I use the complete portfolio and submit this? I probably would not. I wouldn't post this anywhere publicly. I also left out references out of my portfolio because I just did not want to post that publicly right now. But of course, when you apply for jobs, you need to submit references at some point. I think my comfort zone is more with just submitting a resume and a cover letter and maybe including additional items within the resume. I like having a LinkedIn profile. I think that gives a nice visual. And a lot of people are on LinkedIn, so I think I would prefer something like that. So since I did not add a reference in the portfolio that I submitted for this class, going forward, if I was to submit something similar for jobs, I would include references. The only reason I did not include that was for personal reasons. I didn't want to, or I didn't feel comfortable showing my references. And I would include more work projects. Right now I had included projects I worked in school, but I would also include projects that I have worked in my actual job. The only reason I did not submit those in this current portfolio is because a lot of the work is confidential, so did not feel comfortable submitting that publicly right now. Thank you everyone for watching my portfolio and presentation update. I look forward to seeing everyone's portfolio and the presentation topics that you guys will be researching.